do we have the right diagnosis in for low back pain? And so let's take a little closer look at that. So I just picked out a sample of different codes that can be lumbosacral in nature. We all know sacroiliitis, M46.1, but there are specific characteristics in the history that will make a sacral problem more likely, such as sit to stand and walking and prolonged standing. Those are typically something that involves a sacroiliac joint complaint. And if they have pain with sit to stand, then typically that's not a lumbar facet problem. And so your history and the provocation and alleviating factors, and then the objective findings should point you to that diagnosis. The next one is vertebrogenic lower back pain. And that one is used a lot. I've done peer reviews for about 15 to 20 years. I've also done IMEs, and I see vertebrogenic low back pain used very consistently, but that diagnosis is used, it's overused, and you really can't use that one unless you have something happening with the actual vertebral end plate or something to do with the disc end plate union. And you usually need x-rays or some kind of imaging to be able to, say that. So Schmorl's nodes would be a good example of a vertebrogenic low back pain, but you're not going to be able to pick Schmorl's nodes up until you have an MRI. And so you have to be clear and specific of which low back pain diagnosis that you're using. Another one is low back pain unspecified, and I also believe that this one is somewhat dissuaded from being used at KMC University. I've gone through the KMC University kind of a retrospective chart review, and it was a very illuminating process. And a lot of the diagnoses that we're still getting paid from insurance, we had to go back and change because our diagnosis was not matching our history and our exam. Other low back pain is another one, and that's kind of a catch-all if you really don't know what's happening and you think it might be a facet or it could be a disc, but you're really not sure and you don't have imaging to back that up, then that's one to use. And then the next one is lumbar radiculopathy. And this one is used for anyone who says they have sciatica, but you have to have specific criteria in order to use this one. And I'm going to go over that in a cervical example in just a second. The other two are lumbar facet syndrome and lumbar spinal stenosis without neurologic pain down the legs. And there are things that, again, that should be in your history and exam to justify the use of that code.